Thank you. 7:47 now for today's Foxy Moms Wellness Wednesday. If you are looking for a long-term treatment for allergy symptoms, you may consider an allergy shot. Dr. Eric Kaplan with Colorado Springs Allergy and Asthma Clinic is here to explain. Good morning.
Good morning. How are you?
I'm well. So how does this work? Is it kind of like a vaccine, or how would you compare it?
Right. So allergy shots are nice because they're a natural alternative to medicine. So allergy shots are not a medicine at all. What we do is we take the things that a patient is allergic to, we put it in a vial, the vial gets diluted down fivefold, and then they get weekly injections in increasing amounts until they get built up to a top dose, and then it's usually just once a month. So it builds a state of immune tolerance in the body versus this overactive immune system, which is what a lot of people with allergy have.
Is it cost effective in the long run?
Oh, absolutely, yeah. There's been a nice study, especially in Florida children, to show that it's much more cost effective in the long run compared to medications. So a lot of people with allergies suffer, and they suffer every single year,
right,
and they're taking medicines all the time. And so a lot of people just say, well, look, what else can I do? You know, I'm sick and tired of taking these medicines. They're not working in the first place. I'd like to do something to treat the root of the problem. And so that's what allergy shots do. They treat the underlying root of the problem. They treat the cause versus medicines, which are just treating the symptoms.
And who would benefit from this? I mean, adults obviously, but can young children also get the allergy shot?
Absolutely. And so we'll see kids, you know, down to the age of 4 and 5, 6, somewhere around there, but kids that are certainly are allergic to insects, so bees, wasps, yellow jackets, fire ants, and hornets, those patients, we can reduce their risk of a systemic allergic reaction, anaphylaxis, down to almost 0. People who are allergic to pollens, dogs, cats, especially those kids that are living with the animals that they can't get away from. You know, I mean, no one gets rid of the pet. Pets are part of the family.
Right, right.
So rather than be miserable all the time, we can actually desensitize the body.
This doesn't work for food allergies, though.
Right, it doesn't work for food allergies, so they're working on oral desensitization for food allergies. So that's going to be a tablet or a drop underneath the tongue, and there's a lot of good success with that. So with our patients with peanut allergy out there, we should have some desensitization therapy, but it's not going to be in a shot, it's going to be in a tablet or a drop, hopefully.
So what types of things do you need to take into consideration if you're thinking, okay, this shot, this may be something I want to try? What are some of the things you need to think about?
Right, absolutely. So you want to make sure that you're at least looking at a board-certified allergist to do your allergy shots, because that's what we do. That's what we're trained to do. That's all that we do. So when you look at the package insert for allergy shots, it says right on there, there's a boxed warning that you should do this in a clinic that's designed to treat allergic reactions, and you should wait 30 minutes after your shot. So you want to make sure you're doing them safely in that clinic designed to treat a systemic reaction, waiting the 30 minutes. That's critically important when you're talking about allergy shots, because remember, we're injecting your body with something it's allergic to.
Right.
So it should be done in a very safe environment. Board certified allergists, this is what we do. And so again, we do a 2-year fellowship training just to do that. I look at all the skin testing personally. I write the extracts personally. I write the prescription personally, so we know that it's done right.
All right, lots of things to consider, and again, you want to get it done by a professional, and you have a website people can learn more.
Yeah, so we're csallergy.com. This is a really good time to come in and get tested too, because you have to be off antihistamines to get tested. And when in the cooler months, it's a little easier to come off your antihistamines to get tested, so you're not as miserable. So, you know, come in now while it's easy to come off those meds.
All right, Dr. Kaplan, thanks so much. We will see you in a couple of weeks. What are we going to talk about next? We're going to talk about Halloween. It's just around the corner.
Yeah, safe trick-or-treating for
that's very
kids
important.
with peanut allergy.
All right, thank you, sir. We'll see you in a couple weeks.
7:50.